Today's article is titled The Effect of Novel Cryotherapy Technique on Postoperative Pain for Bulbotomy in Permanent Molars with Symptomatic Irreversible Bulbitis. It's a randomized controlled trial conducted by a Turkish group and published in Journal of Endodontics recently in 2025. In the literature, formerly, the preferred treatment option for teeth with symptomatic irreversible bulbitis was root canal therapy. However, the emergence of new evidence indicating that clinical symptoms may not accurately reflect the histological status of the bulb tissue, along with the new information regarding the reparative capacity of the bulb tissue and the development of biocompatible materials, has encouraged the application of vital bulb therapies as alternative to root canal treatment in recent years. And cryotherapy has recently gained popularity as a technique for reducing postoperative pain in endodontic practice. Therefore, the aim of this study was to evaluate the effect of the application of cryotherapy with cold saline on postoperative pain after full bulbotomy procedures in patients with symptomatic irreversible bulbitis in permanent molars. Now, as for the methods, this study is a single-blind randomized controlled clinical trial. It included 42 females and 24 males aged 14 to 60 years who were systematically healthy and had permanent molars with symptomatic irreversible bulbitis. The inclusion criteria were first and second maxillary or mandibular molars with moderate or severe pain according to the VAS, teeth that responded positively to the code test and electric bulb test, teeth that responded negatively to percussion and palpation tests, and teeth without periapical pathosis. As for the group randomization, patients were randomly assigned to the control group or the cryotherapy group using online software, and all endodontic procedures were performed by a single operator. As for the bulbotomy procedure, the procedural steps according to the study groups were as follows. For the control group, which included 32 patients, the exposed bulb tissue was irrigated with 5 ml of 2.5 sodium hypochlorite. Cotton pellets moistened with 2.5% sodium hypochlorite were used to achieve hemostasis. And for the cryotherapy groups, which consisted of 30 patients, the same procedure was done, and after hemostasis was achieved, the bulbotomy area was irrigated for 5 minutes with normal saline solution, which was kept in a cooler set to 2.5 degrees Celsius and verified with a digital thermometer. And in both experimental groups, if hemostasis could not be achieved within 8 minutes after the removal of the control or the coronal bulb tissue, root canal treatment was performed, and these patients were excluded from the study. And after hemostasis was achieved, the canal orifice and bulb chambers in both study groups were covered with 2 to 3 millimeter thick biomineral trioxide aggregate, and final restoration was done. And patients in both groups were prescribed 400 milligram of ibuprofen after treatment and were instructed to use it if necessary. And for the postoperative evaluation, a blinded researcher performed the observation of postoperative pain in this study. A questionnaire was administered to all participants on the basis of the VAS score, which revealed their pain levels and analgesic intake at 6, 12, 24, 48, and 72 hours postoperatively. The results showed that none of the teeth had an intraoperative diagnosis of bulb necrosis, owing to failure to achieve hemostasis within 8 minutes. One tooth from each group was excluded from the study, and the remaining 64 teeth were randomly divided into 2 groups, and full bulbotomy treatment was performed. 2 patients were excluded from the cryotherapy group during the follow-up period. And as for the basic demographic data and preoperative pain scores of the 2 study groups, there were no statistically significant difference in the preoperative pain scores between the control and cryotherapy groups. Compared with those in the control group, the postoperative pain scores at 6 and 12 hours were significantly lower in the cryotherapy group. Postoperative pain scores at 24, 48, and 72 hours were similar in both study groups. And in the control group, there were significant difference in the postoperative pain scores between 6 and 24, 48, and 72 hours. And in the cryotherapy group, there were significant differences in the postoperative pain scores between 6 and 48 and 72 hours. And in the control group, 5 patients used analgesics during the postoperative period, whereas in the cryotherapy group, 2 patients only used analgesics, and there were no statistically significant difference in analgesic intake between the control and cryotherapy groups. So to conclude the findings of this study, during vital therapy, the cryotherapy application after hemostasis reduced postoperative pain in permanent molars with symptomatic irreversible bulbitis in the early period. However, this study comes with limitation, which is the fact that they determined the degree of inflammation in the bulb on the basis of clinical symptoms only, which is not always accurate, and biomarkers such as TNF-alpha, interleukin-6, interleukin-8, and MMP-9, which could indicate bulb health, were not evaluated. Additionally, the fact that the randomization of the study groups was performed prior to the treatment and that the syringes used for the cold saline solution in cryotherapy were cold, making it impossible for the endodontist to remain blinded, can also be considered limitation of this study.